Hi, I am Dr. Joel Yarmush. Everybody calls me Jody. I am the program director at the Department of Anesthesiology at New York Presbyterian Brooklyn Methodist Hospital.
Now we're gonna ask you a few questions that we got on Instagram. First one is, do we have a cutoff in the years of graduation at this program?
I understand the question correctly. The person is asking if they've been out of the system for a while, is there some point where it's too many years away? There's no official cutoff. There are concepts if you've been out of the field or out of medicine, or you were in anesthesia and out of anesthesia for a while and it's affected you, there may be some problems with that.
What is the most important aspect of the CV for applying to anesthesia?
Well, that's a loaded question. So the most important aspect of the CV is not on the CV. Most important aspect of a person's is the personality. So how good a person they are, how nice a person they are, how compatible a person they are, how much they want to be an anesthesiologist, how much they fit into our program, and that's probably true for every program. That said, the most important thing on the CV, or the most important thing it seems to be on the CV, are the USMLE scores. Let me go explain that. The USMLE scores tell the program directors how well you'll do in a national exam. And that's very important for the program, for the ABA and the ASA, mostly ABA, in passing exams. The anesthesia exam is harder than the USMLE in general, but that will give you an indication of how well you will do on the exams. So as such, that most CVs start with that. Our rule is we take the average plus or minus, in this case minus, the standard deviation and set that as a practical minimum. It used to be 2 exams, the USMLE 1 and 2, so it was not quite an exact science. Now the USMLE 1 is pass-fail, so everything depends on the USMLE 2. The USMLE 3 is not necessarily indicative of how well you'll do. So the USMLE 2 is probably the most important thing on your CV.
I think this question goes along with the first one about the years of graduation, but they're asking, what do you think about old IMGs with lots of experience as clinical assistants to other NDs?
Okay, let's analyze the question. You're an old IMG, you suddenly had an epiphany, and you now want to be an anesthesiologist. That is an unlikely scenario.
Yeah, I think most people actually are working towards the goal of becoming an anesthesiologist, but it's hard in between. You have to.
For some reason, there's a delay.
Yeah.
Now, if the delay is still there, the reason for the delay was you didn't have a particularly impressive resume. Your USMLE 2 was not good. You didn't have good interviews, or you didn't. Something was wrong. It's not a matter of old. It's still something might be wrong. If the thing was that you didn't have stuff. You weren't initially an anesthesia person, and you felt that you needed to do this and that, you did this and that, you had personal reasons that you needed to delay. Age shouldn't make that much of a difference. So the old, if it's just age, if you are still ready, you're energetic, you're enthusiastic, that's what matters. It's not that you necessarily want a 25-year-old, 30-year-old, 35, 40-year-old, even a 45 or 50-year-old could be an excellent resident and still have many productive years of anesthesiology.
What do you think is the main difference between a strong candidate and a not so strong one?
there's the obvious objective criteria. So one has a much better USMLE than the other. One has much more experience, and not necessarily experience in anesthesiology, but has better letters, one has something objective that we can quantify. Then there's the stuff that's you can't really quantify. One is a better personality. One is more outgoing. One is more enthusiastic. One you enjoy speaking to more. One is, and that will come across. So in the interview, you'll have a chance to demonstrate that. Sometimes you may not get there because the objective criteria is not as good one to the other.
That was kind of my next question. How do you select who to interview?
Okay, so the interview process is there's usually we make 3 piles. Definitely want to interview. The other we definitely don't want to interview. And the middle pile, which is the biggest, which is undecided. So the ones that we definitely want to interview, there's something special there, maybe objective, maybe subjective, but there's something special in the application, and we very much want to interview. And the ones that we very much don't want to interview, it's equally, it's there that there's something that we don't want to see. And then the bulk of the people are, we're not sure. People at this point are fairly competitive, and then we set it up and we go through. Obviously, we interview the people who we really want to interview first, and if that's sufficient number, we might not get to that. That's rare. And then we start getting to the other people.
Okay, what would be something that puts someone in those piles? What would be something that puts someone in a pile that you really want to interview? What's something that would put someone in the pile that you won't even look at?
Okay, so the objective factors, if your USMLE is, stupendous, if your...
What's stupendous?
What's stupendous? So if it's 1 standard deviation above the mean, that would put you probably in the stupendous. It won't necessarily guarantee you an interview, but it certainly lends itself towards getting an interview. If someone who we know has had you as a medical student, has had you in a rotation, has had this, and they come and call us and say, this person is the real deal, I think this person would make a great resident, I think he or she would fit in very well, that's a big factor. If the person has something different, all right, the Olympics are on now, and so if someone were, had swam for the Olympic team, the USMLE might suffer from that, but there's something that person has demonstrated an ability to go above and beyond, and that's the same ability above and beyond that would be, something that would be stupendous. So something that's not, if the person's USMLE was not good enough. So again, we try to make a practical minimum of 1 standard deviation below the mean if it was well below. If the person who we know, we called someone or spoke to someone at the institution where the person was and said, I'm not sure about this, that might be something that might be, off-putting. There's, the bulk are, most fall within that 1 plus or minus standard deviation. They have reasonable letters, reasonable application. They've done an interesting, smattering of stuff, and we'll see.
What do you think about the people that barely passed or had a low score versus the people that failed it one time and then the second time did great?
The purpose of the USMLE is not to show a passing score, is not to show that you know the information. The purpose of the USMLE, as far as we look at is whether you can take a standardized test. Nowhere passing, failing, doing well, doing poorly does it mean that you didn't know this subject. It's very helpful if you can pass the USMLE, if you can do very well in the USMLE, that says that you can study to pass the anesthesia exams. So failing it because you weren't ready, failing it because you had a cold, failing it for whatever reason, then coming back and getting a very, very impressive score means you could get a very, very impressive score. The pass-fail is virtually worthless. Whoever rallied to have that, whichever medical student rallied, probably did a great disservice to themselves. I understand it takes the pressure off, but now the pressure is now twice as much on the USMLE too. Yeah. So I think it was one of the things that we always looked at is those people who are somewhat discongruous. They did okay on one and did great on two. They did great on one and did okay on two. If you do great, you've done great. I might, ask why you didn't do great again, but still, you've done great. It's obviously better to do great on both, but if you've done great on one, you can do great, and that's more important in my view than, just passing.
What do you think about networking? Like getting to know people in the field, like people that can call for you, talk for you, or...
Working is important, but not for the reasons you think. So one of the questions that every discipline wants to know is why you're going into that discipline. And anesthesia is no different. At some point, we're going to want to know why you want to go into anesthesia, why you think you want to go into anesthesia, why you think you'll be good in anesthesia. And the networking demonstrates that you're interested. The networking is not just talking to people. Networking, going to the conferences, seeing what it is, talking to people, getting an idea what anesthesia is all about, is very useful. Obviously, the basic network of doing the rotations in medical school. One of the questions we are going to ask is what rotations you've done. How do you know you want to be an anesthesiologist? The person whose father or mother are anesthesiologists doesn't have to network the same way. Why you want to be an anesthesiologist? I went to work with mom or dad. And that will give you, and if you're still interested, that's a good sign. So I think networking to just get someone to call for you is, if you got the right person, it may be useful. But presumably the right person then investigated you further and knew that you're the right person.
Is research an important criteria to match in a competitive specialty as a fresh graduate? I feel like in general, is research...
In general, they're asking because I'm talking about anesthesia.
Yeah.
So I can't tell you what it is in other disciplines. Anesthesiology is mostly a clinical discipline. And no matter what part of the field thinks that research is important, it's not important for the residency. It's helpful, maybe a small box for the residency, and it may be helpful to train scientists, anesthesiology scientists, but as far as the application, as far as wasting time, and I use that word carefully, doing research to get into a program, it's not useful. That same time could be spent in doing something that is useful and showing that you will be a good resident and a good anesthesiologist. It's not that research is not important. Research is incredibly important. But the question is talking about, is research important to get into anesthesia? Yeah. A lot of programs, especially university programs, might want you to do some research, but no, the answer is no.
And what about if you have time? Because, the application season hasn't started. and you have some time, what is something that you could do to help your application?
Well, it's probably the wrong time to start. If you needed to do something to help your application, it should have been way before. But the question is, if you have some time, what should you do? So depending on what you have. So if you're still a medical student and you have some time, I would suggest do more anesthesia rotations. One, you'd see whether you really want to be an anesthesiologist. You'd also be able to give a better idea that you would be a better anesthesiologist. Do you have a problem waking up in the morning? Do you have a problem working late at night? Do you have a problem working with others? So probably if you have the time as a medical student after, you probably want to do more rotations. Also, you might want to do some sort of subspecialty. If you want to see what pain management is, you want to see what cardiac anesthesia is, you want to see what pediatric anesthesia is, that might be a good time. As far as not doing that, so you're out of medical school, you finish 6 months early, now you have 6 months, what should you do? I don't think research is necessarily the right thing. Ultrasound is getting more and more important. TEs are getting more and more important. Taking a course or studying ultrasound, studying TE, learning those things. If you want to get credit, you pretty much have to take a course and get something, getting certified in TE. I don't know that there is a certification in ultrasound, but learning how to do that, practicing, finding some place to do it, learning all the physics, learning all the hand-eye coordination that's necessary is not a bad idea. On the same vein is getting a jump on some material you want to learn. Anesthesiology is a lot of material, and to actually go through a book and review some of that book so that you're prepared for that stuff is not a bad idea.
Or let's say a person that tried to get into anesthesia and didn't get it the first time, and it's applying for a second time.
He has
you have a whole
another
year.
Okay,
Mm-hmm.
so he basically, not quite a year, because he found out in March with the match.
Yeah.
So found out March, and now instead of that, so it's now going to be April, May, June, July, August, September, and October. So still a lot of time. The first thing you need to do is try to find out what was deficient. I don't know, because it's very impersonal, the application, if you can find out. If you know what's deficient, try to remediate that. So if your USMLE score was not adequate, it's very difficult to remediate. One of the things you need to do is you need to do something to convey that you are going to be able to pass this test, which the USMLE score said you weren't, or you were at risk. That you have to be creative. You can try to organize something where you can demonstrate that you are doing, just that. You can do work for a department unofficially and somehow take one of the department tests and show you've done a good job and sort of try to remediate that. I'm assuming the USMLE is the problem. That's the toughest one. You've now, if the USMLE 2 has an average of 248 plus or minus 15, so 233 and your score is 218. So it's not failing, which is 202 or something, and it's not within that first standard deviation. It's difficult. I would have told you before that study, but if you're now there, you need to try to impress upon someone. So anesthesia, you have to have a first year, separate than anesthesia, even if it's through the anesthesia department. It's medicine, surgery, OBGYN, pediatrics, any primary care, and then 3 years or more of anesthesia. An alternative to be, if you can't, is do the 1 year, but instead of 1 year, because you're already going to lie fallow for a year, do the second and third year, get a medicine or pediatrics. That would be very positive, and then also get the boards. So now you're coming with not a good USMLE, you're coming with a board certified medicine, board certified family practice, board certified pediatrics, where you've shown that you can do it, and the USMLE is not reflective. And it's not necessarily a waste. What you've done now is you're now a powerhouse in pediatrics, and now you can do pediatric anesthesiology and be better. You've only spent we're assuming you had to spend the second year. So you've only spent 1 extra year doing that. That's a positive thing. There are some problems with that, but not many.
What problem?
The problem with that has to do with the way Medicare pays. Medicare Part B pays for residency. So they'll only pay for 1 residency. They'll pay 50% for other residents. So there are some departments in the country that don't want you. Most don't mind it because you have added benefits. You're a board certified pediatrician, you're a board certified internist, you're a board certified family practitioner.
What do you think are definite red flags in an application?
Anybody who doesn't like pizza. That's a definite red flag, and I would suggest you not apply. Now, a definite red flag other than that, again, not the obvious, not, low scores, low objectives. A red flag for me is someone who, when I speak to them or whatever, I get a feeling that they don't really want to be an anesthesiologist, or if they do, they don't really want to, they don't want to be a colleague. Someone who, I think at a minimum you need to be enthusiastic. At a minimum you need to be you need to feel that this is your, life. This is your life. It's not just a job. This is what you're going to do. You are going to be known as an anesthesiologist. Whether you're a mother or father, whether you're whatever, you're still, when someone asks what you do, you're an anesthesiologist. So if you somehow don't convey that, that's a red flag.
Now, let's say that someone applied, got an interview. What's something that can make them stand out in the interview?
Nothing. You're talking about artificial. What they can do is wear a good suit or a bodysuit. No. What makes them stand out is what they are. So a nice person will stand out more than a not nice person. Certainly there are certain things you can do. If you're not good at interviewing, you need to practice. You need to convey who you are, and if you can't, you need to do that. So it's not something that you can do, but something you can sort of reveal. So I would say it's not a bad idea to go over general questions. Why you want to be an anesthesiologist, but that should be something you can answer. Why you want to be. I get the answer when people say they want to talk about pharmacology and physiology, and I plead with them, please don't. Tell me why you want to be an anesthesiologist. The big question, everybody has pharmacology and physiology. Why don't you want to be something else? So why do you want to be an anesthesiologist? Get your thoughts together and be able to answer that. What have you done? So if you haven't done that, try to make sure you have the experience before. Do you know what anesthesiology is? Be able to answer it. Go see other departments, talk to other people, go to a conference, go something, and be prepared to present yourself. Now, as far as changing yourself, if you're, not very outgoing, it's going to come through. I don't know that you can change that. So there's not something you really can do, but you can sort of reveal yourself. So if you need some practice with interviews, get some practice, talk to people, and go through all those things.
That was the last question. Do you want to say anything else? Do you want any advice?
I would not, part of these questions are what to do after. I would do this, I would look at this not after. I would look at this before. All right? It's true for all of medicine. It's certainly true for anesthesiology. One of the things you want to do is during medical school, you want to try on and see what fits. When you went to medical school, they asked you why you want to go to medical school. And the answers may still be valid, may not be valid anymore. But they're going to ask you the same question, why you want to be whatever you want to be. And in this case, for anesthesiology, you need to know the answers. As far as all the disciplines, you need to get that USMLE 2 down. And that's become a fact of life. So if you go to medical school, start at the beginning, knowing that that's going to be a big deal. Just like you want to do well in all of medical school. You need to, that's an important part of it. Spend some time. If you want to be an anesthesiologist, talk to anesthesiologists. See what it is they do. There's a lot of breadth to the field, And there are differences in practices. Talk to everybody, go to some conferences, participate, and see if that fits. And if it doesn't fit, don't persist. But if it does fit, then continue.